A typical visit is 2 hours,
Mm-hmm.
maybe even 2.5 hours. And
Mm-hmm.
so a typical allopathic visit is maybe 7 to 10 minutes.
Mm-hmm.
So you're really feeling heard at the end of your visit.
Yeah.
And the first hour and a half is an in-depth interview with addressing some of those areas that I mentioned to you, especially exposures to toxins, dietary things. How well do you sleep? Do you like
Mm-hmm.
your job? What's your relationship like? All of
Mm-hmm.
these things. And whether you were born vaginally or cesarean, all of this matters to our
Mm-hmm.
health.
Yeah.
The other part, then we go into looking at a physical exam. Naturopathic doctors are trained in how to examine the body head to toe, just like a
Mm-hmm.
regular medical doctor is. And we often take more time there because there's a lot of clues in the physical exam. What do the nails look like? What does
Mm-hmm.
the tongue look like? Are there
Mm-hmm.
dark circles under the eyes? Is the
Yeah.
skin hydrated? How are the
Mm-hmm.
reflexes? Is this thyroid boggy? What's the
Mm-hmm.
integrity of the skin looking like? How white are the eyes? Are they yellow or red? The
Yeah.
hair, how healthy is the hair? All things that the physical body is showing us all the time. We
Wow.
just have to look from the right lenses, right?
Mm-hmm.
Using our medical detective lenses. So physical exam, and then usually some type of recommendation for lab testing. I really
Mm-hmm.
like to do lab testing. That's very much my scientist, geek, philosophy, physiology
Mm-hmm.
passion that I have.
Mm-hmm.
There are so many good laboratories that test way beyond what the typical blood standardized blood tests from a hospital ER trip or even some medical doctors do. We go
Mm-hmm.
way deeper into the body to look at hormone levels, toxin levels, inflammatory markers.
Mm-hmm.
Inflammation is a huge underlying cause for illness.
Yeah.
And there's lots of markers that are, unfortunately, they're common tests, but they're just not ordered by the medical doctors. I don't know
Mm-hmm.
why.
Mm-hmm.
And they're very good to detect how thick is the blood. Is this person not feeling well because their blood is not moving? Well,
Mm-hmm.
that's D dimer. That's a easy one to show us how thick the blood is.
Yeah.
C-reactive protein, is the body inflamed? And interleukin 6, are there cytokines which are like inflammatory
Mm-hmm.
products that are just high in the body? That means that the body is going to feel a burden and feel unwell. So we can
Wow.
prove and
Mm-hmm.
evaluate how person's feeling just by
Mm-hmm.
lab markers. So
Yeah.
beyond that, there's saliva tests and stool tests that show us what's going on inside the gut, what's type
Mm-hmm.
of microbiome. That's a huge area of study right now. What
Mm-hmm.
kind of bacteria we're holding, the good and the bad, because we may not have enough of the good guys. We may have so much of the bad guys that we're not getting the benefits from our microbiome. We
Yeah.
are 9 times more bacterial DNA than we are human DNA. So we got to get the bacteria right. If that
Yeah.
population is off, we will be off.
Yeah.
So picking the right lab test for the person. And
Mm-hmm.
then when we have lab tests back, usually I send the person home with some wellness recommendations.
Mm-hmm.
And that basically goes through dietary changes,
Mm-hmm.
lifestyle suggestions, and then any supplements that I may have chosen are
Mm-hmm.
also part of that. So, how do I choose supplements? We use kinesiology to distinguish between the two types of echinacea. There's tens of thousands of natural products out there.
Yeah.
And some of them all have similar ingredients or a little bit different. And so
Mm-hmm.
kinesiology is the way that I really individualize my
Mm-hmm.
treatments for folks.
Yeah.
So um, once that's then discovered what supplements they had a strengthening with through
Mm-hmm.
kinesiology, I'll
Mm-hmm.
recommend those things. And I don't like to overwhelm people. Some people have the image of naturopathic medicine, meaning a bag full of supplements, and that is definitely not the way to go. I'm very sensitive to that. Some of my patients come in, they're like, I've been really good. I have this bag full of things. And I'm like, you know what? That's not sustainable. You're not going to be able to take all those things for a very long period of time. It's too stressful to have to take all these things.
Yeah.
So I work with folks to meet their needs and their preferences and their and consideration of their budget. So we try to create a protocol that's going to be effective but easy. Easy. I think naturopathic medicine has some myths about it also, about it being very difficult and very expensive, and it does not have to be that way at all. So we typically start with a focused protocol that's going to be effective, and then usually the beauty of naturopathic medicine, when the body is getting the right nutrition and the right supplement if it's needed and the right environmental conditions, healing can happen very fast.
Yeah.
And so within 3 weeks, I like to see patients back in my office for a follow-up consultation. Because then I'll know if things are improving, great. If they're not improving, it's because there's something underlying or there's some other factor that I haven't discovered yet that we need to talk about and address.
And I would say that I can imagine that, someone who's in your office feels really heard and really understood and really taken care of. But I've actually experienced that because we had a session with you, and in that session, we learned so much about the body. Right there, it didn't feel like you were trying to withhold information, like you wanted us to learn.
Right. Yes, of course. We work together. And the patient and their family members are a big healing component. I put a lot more faith and expectations on the person and the family members to heal than the supplements that I prescribe, right? So absolutely. It's about empowering with knowledge to simplify so that a layperson can understand their illness. So often taking time to explain, this is what I'm testing for. This is sort of the physiology in simple terms. And when they understand also the medicine and how it's supposed to work, you heal better, because now when you take that medicine, you have no doubts about it. There is something called the placebo effect, which 30% of the success in some clinical trials is due to the placebo effect. Well, I'll take that 30% in my favor. And if I can tell the patient and set a healing intention, why not? Why not empower the person with knowledge? This is what this is going to do. Set the intention, and then we actually manifest that. Why not?
Beautiful. I love that.